Every day, humanity battles over 30,000 known diseases, disorders, and medical conditions. Progress is being made. Life expectancy is rising. And yet, 95% of the world's population suffers from at least one medical condition. All of these people, no matter their background, beliefs, and degree of illness, all of these people share one single, all-powerful antibody: hope. For this hope, there's but one known wellspring: research. Understanding the mechanisms of disease is at the heart of conceiving new pathways to treatment. From imaging and diagnostics to pharmaceutical and biotechnology products, to the integration of cutting-edge medical technologies and digital health solutions, with every new startup, incubator, and accelerator, with every new scientific breakthrough, comes a giant leap of hope for every patient, no matter how rare their condition. For over half a century, the Galien Foundation has been fostering and recognizing the tremendous contribution of the world's finest research teams to improving the human condition. Each year, it confers the world's supreme accolade, the Prix Galien, to the unsung heroes behind the progress. An accolade strictly based on merit, the prestige of the prize is distilled in the rigor of its committees, which count some of the world's most distinguished biomedical researchers. The award is recognized by its iconic medal crafted by renowned French sculptor Albert de Jaeger, laureate of the prestigious Prix de Rome.
I thank the Galien Foundation for recognizing that a healthier world is a safer world and a more just world.
The Foundation bestows the Roy Vagelos Pro Bono Humanum Award to individuals and organizations who have made considerable altruist contributions to improving human health worldwide, and especially to developing and underserved populations. The first prize was conferred by the late Elie Wiesel, Nobel Peace Prize laureate and Galien Foundation honorary founding president.
All these men and women are trying to save human lives. Is there anything more noble than that?
Hope, a prayer answered by innovation. Join the Galien Foundation. Together, we can change the state of human health.
Ladies and gentlemen, please welcome Ken Fraser and Mike Rosenblatt, co-chairs of Prix Galien USA committees.
Good evening, ladies and gentlemen. It is my great privilege to welcome you to this year's Prix Galien USA Award ceremony here at the historic American Museum of Natural History. Tonight, we gather not just to present awards, but to celebrate human ingenuity and perseverance in science, medical advancements, and technology. All achievements that impact the health and well-being of people worldwide.
Thank you, Ken. It's always an honor to stand alongside you and among so many distinguished innovators, leaders, and friends of science. The power of the Prix Galien is not just in recognizing progress, but in reminding us that medical research is the best way to transform health. And drug invention is ultimately an act of commitment and compassion.
And that is precisely why the Prix Galien is about more than scientific achievement. It is about human achievement. Tonight, in addition to recognizing innovation, we also celebrate the values of service and humanity in medicine.
That's why the Roy Vagelos Pro Bono Humanum Award stands as the highest distinction of the Prix Galien. It honors not only discovery and invention, but the courage to place humanity at the center of innovation.
We are particularly moved to present the Roy Vagelos Pro Bono Humanum Award for global health equity. Roy isn't just a former Merck CEO. He's a visionary who continues to shape our industry. His mentorship instilled in me a lasting commitment to innovation, ethics, and global health. Roy's leadership set a standard that I've always aimed to uphold. His dedication to improving lives through pharmaceutical advancements and corporate responsibility continues to influence Merck, myself, and so many of us here tonight.
Ken, as you know, I too have had the good fortune to have Roy as a role model. This year, the Pro Bono Humanum Award, named for Roy, is presented to Michael J. Fox. Michael could not be with us in person this evening, but he has a recorded message, especially for the Prix Galien community.
Thank you to the Galien Foundation for the honor of the Roy Vagelos Pro Bono Humanum Award. I share this with the scientists and risk takers here tonight who will help cure Parkinson's. Ali Wiesel's legacy asks us to repair the world. Thank you for honoring our foundation's work toward that goal.
To accept the award on behalf of the Michael J. Fox Foundation, please welcome Lisa Boudreau, Chief Development Officer.
Thank you, Mike. Thank you, Ken. What a privilege to be here with all of you tonight. You know, when you work with Michael Fox, when you work at the Michael J. Fox Foundation, you see Parkinson's disease everywhere. It's in our community, it's in our staff, we see it everywhere. But oddly enough, at this special moment, when this extraordinary foundation is honoring Michael, Parkinson's disease actually is in the news everywhere, and I think you've seen it just as I have. You might have seen 2 weeks ago the New York Times article that did a video diary in a description of the wonderful Sue Goldie, professor of global health and public health at Harvard University, who was diagnosed with Parkinson's disease 4 years ago, but kept it quiet for all that time because it is such a devastating disease. She came out in the New York Times article with video diaries. It was heartwarming, it was heart-wrenching, it was beautiful. And she talked about figuring out how to live with this awful disease. You might have seen earlier this month that Apple TV announced that the 3rd season of Shrinking is coming out in January. If you don't know what Shrinking is, I highly recommend you watch it. Harrison Ford plays a psychologist who has Parkinson's disease, and he does it brilliantly. And in January, when the 3rd season comes out, Michael Fox will be his co-star. And then, of course, there's Michael Fox himself. You might have seen him. This isn't the kind of news I think that this crowd typically sees, but I'm going to tell you, he's on the cover of People magazine. He was on Late Night with Stephen Colbert. He's been on The View. He was on the Today Show at NBC being interviewed by Willie Geist. He was at the 92nd Street Y with Donnie Deutsch. He came out with a book 2 weeks ago called Future Boy. And so he's being interviewed everywhere. Future Boy is about the making of Back to the Future. And in these interviews, he talks about that movie. He talks about playing Alex P. Keaton and Marty McFly at the same time. And for those of you who are not 80s children like I am, that's Family Ties and Back to the Future all at the same time. And inevitably, when the interviewers talk with him about his legacy and his work in this book, they come around to the Michael J. Fox Foundation, and each time they say, is it true that your foundation has put $2.5 billion worth of money into research for Parkinson's disease? And I'm here to tell you it's true. If Michael were here tonight, and he wishes he could be, and I know you all wish he could be, he's really quite Wonderful. He would be humble, and he would be kind, and he would be generous of spirit, and he would tell you all that you are the reason we are making progress in Parkinson's, and he is exactly right. And he wouldn't take any credit of his own, but because I'm here, I get to give him some credit, if you'll allow me. The Michael J. Fox Foundation was founded in the year 2000. At that time, you could count on one hand the number of therapies that were available for people who had Parkinson's. In the last decade, there have been more than 20 new therapies approved by the FDA that treat the symptoms and manage the symptoms of Parkinson's. That is spectacular. It's not enough. What the Fox Foundation has done is become an organizing body for the world's research community in Parkinson's, and you all are part of that. And I know that because 20 of the companies that are here tonight were with us at the Parkinson's Disease Therapeutics Conference just a week ago. So you are a part of our world, and we're grateful. And so Michael would say it, and I'm going to say it, thank you. The extraordinary thing about this moment from the year 2000, when there were only 3 drugs or a handful of drugs for Parkinson's, is that right now, and you probably know this better than I do, there are 175 drugs in clinical human trials for Parkinson's disease. Half of them manage symptoms, half of them reach the underlying biology of the disease and aim to slow or stop the progression of the disease. That is an extraordinary achievement in 25 years. We are so proud. The role of the foundation has been to seed the research, to de-risk the process of drug development so that we can get to this point, and we are widely optimistic about what's next. And what we are hoping for, and what I think you all are hoping for, is that there will be a time that we can diagnose Parkinson's before symptoms arise, and that we have therapies that will stop the onset of symptoms, thereby meeting Michael's promise to cure Parkinson's disease. Thank you. We're doing this with you, and we are so proud to be your partners. In one of the recent interviews that Michael had on this circuit that he's been in, he was asked about Back to the Future, and he was relaying that Back to the Future is a movie about bullies. Biff was his nemesis, his bully. And he said he was asked if he could go back in time, what would he do? Would he want to turn back the clock on Parkinson's? And I'm going to read to you his response so that you have a piece of Michael. So I don't think I'd change. To go to another time means to want another outcome or to want another reality. I don't want another reality. I'll take this. I always say that it's, in its own weird way, Parkinson's, for me, has been, and I understand a lot of people would be doubtful of this because you may have Parkinson's, but Parkinson's has been, in some ways, a gift to me because it's taught me a lot about patience and about compassion, about strength, about what I'm capable of accomplishing, and what I can expect from other people and how much they mean to me. So I wouldn't change anything. I just take it and move on. And I think we'll win. Bullies, we have a bully epidemic right now, and we've got to face these bullies and beat them. And Parkinson's, like I say, is the biggest bully of all for me. And I'm ready to kick its ass. When you work with Michael, and when you work at the Michael J. Fox Foundation, you see Parkinson's disease everywhere. Because of Michael, and because of our partnership with all of you, in the very near future, we won't be seeing it everywhere anymore. Thank you, Mike. Thank you, Ken.
Thank you, Lisa. Please extend our admiration and gratitude to Michael and the entire foundation, and let him know how grateful this community is for his contributions to health.
Before we move forward, I would like to recognize the laureates from this morning's Prix Galien Innovation Forum, honored in digital health, startup, and incubator accelerator categories. Their achievements reflect the creativity and bold thinking that drive the next wave of innovation. They will join us on stage a bit later for a memorable group photo during our celebration. And now we turn to the medical technology category, celebrating engineering excellence and scientific precision in service of patient care. I am pleased to welcome my colleague on the jury, Dr. Penny Heaton, to the stage so that we can announce the laureate. In the meantime, let's see who the nominees are.
In the Best Medical Technology category, the nominees are Abbott for Avere Dual Chamber Leadless Pacemaker System, Abbott for Esprit BTK Everolimus Eluting Resorbable Scaffold System, Abbott for TriClip G4 System, Alcon for Total 30 Soft Contact Lenses, Beyond Air for LungFit PH, BioMeriU for BioFire Spotfire System and Respiratory Sore Throat Panel, BioProtect for BioProtect Balloon Spacer, Body Vision Medical for Lung Vision, Boston Scientific for Farapulse Pulsed Field Ablation System, Cressalon for Trauma Gel, Edwards Life Sciences for Edwards Evoke Transcatheter Tricuspid Valve Replacement System, Edwards Life Sciences for Edwards Sapien 3 Ultra Resilia Transcatheter Aortic Heart Valve, Endologics for Detour System, Establishment Labs Holdings for Motiva Flora Smooth Silk Tissue Expander, Guardant Health for Guardant 360 CDX, Impulse Dynamics for Optimizer Smart Mini System, Medtronic for Inceptive SCS, Medtronic for MiniMed 780G Automated Insulin Delivery System, Medtronic for Simplicity Spiral Renal Denervation System, Our United Corporation for Tai Chi Pro, Perspectum for CoverScan, Polarian for Zeniview HPX System, Reflection Medical for Reflection X1 with Syntix Biology Guided Radiotherapy, Smith & Nephew for Cori Surgical System, Teramo Aortic for Thoraflex Hybrid,
So thank you, Ken. Thank you, Meg. And good evening, everyone. It's just a pleasure to be here tonight to celebrate the incredible work that's happening in medical technology. I think of it as a field that is truly bringing together science and engineering, and most importantly, heart. Here in the US, innovation in medical technology, it's changing lives every day. Whether it's a device that helps people walk again, or a device that gives a doctor clearer insights into how to save a life, or if it's something that just helps patients manage their own care from home. These advances are improving health in ways that we could have only dreamed about a generation ago. And what's so inspiring is how much compassion sits behind this innovation. Each of tonight's nominees, they represent a team of people that's driven by that goal, that one goal, to help others live better, longer, and healthier lives. And now we're going to learn who the winner is of this wonderful category. So it's truly an honor to recognize the commitment and creativity of all of the nominees, but now it is my privilege to announce that the 2025 Prix Galien USA Award for Medical Technology goes to Edwards Life Sciences for the Edwards Evoque Transcatheter Tricuspid Valve Replacement System. So we welcome you to join us on the stage.
Ladies and gentlemen, please welcome to the stage the Ambassador of Edwards Life Sciences.
This is wonderful. I accept this award on behalf of Edwards Life Sciences and the hundreds of people that have worked on this device for the last few years. It's a space where maybe not a lot of attention has been paid for the last few years, but now it's become more mainstream. If I were to be honest, I was sent the speech and don't worry about it. But here we are right now. Okay. Yeah, I was told, don't look at the speech, don't worry about it. So yeah, I accept this. Yes, I want everybody who's working for this device, but now I can actually say thousands of patients, and I can say a few of us, myself and Scott Usier, have been here from patient number 1, and we have treated over 5,000 patients as of now, and this is it's an incredible journey. So thank you. Thank you to everyone who's worked on this, and yeah, I didn't read the speech, so thank you.
I now invite my fellow jury colleague, Michael Dolston, and all laureates from this morning's ceremony in the Digital Health, Startup, and Incubator Accelerator categories to join us briefly on stage for a symbolic photo. Congratulations and thank you all for your unwavering commitment to advancing human health. Your dedication lights the path forward. Please enjoy the rest of the evening.
now please welcome to the stage Bruno Cohen, Chairman of the Galien Foundation.
Esteemed guests, sisters and brothers, Tikkun Olam, in Hebrew, repairing the world, is a call to action. Holocaust survivor, Peace Nobel laureate, our honorary founding president, my spiritual father, our beloved Elie Wiesel, urged us to think higher and feel deeper. Tonight, we honor that call as we celebrate Michael J. Fox, a man who transformed personal struggle into a global movement for dignity, for science, and for the voice of the patient. It is no coincidence that this morning we inaugurated the Galien Patient Summit. Lisa and Michael remind us that true innovation fulfills its purpose only when it brings hope to those who are waiting. All of you here tonight, the precious tribe of the life science innovators, through your Prix Galien nomination, you carry the torch of hope. Please give yourself a well-deserved round of applause. And let it be clear, this evening there is only one winner, human race, and only one loser, disease. The Galien spirit continues to expand beyond borders. In December, we launched the Nordic region of the Prix Galien in Stockholm at the Nobel Forum. And in 2026, the Galien journey continues into Asia with Prix Galien Japan, South Korea, and China, bringing together our community across 5 continents. Before I conclude, a word of tribute. This year, we mourn Marianne Wiesel, a woman of strength who supported and enriched our Galien family. May her memory guide us with integrity and compassion. And I salute the presence of Elisha and Lynn Wiesel with us tonight. Around the globe, the Prix Galien is considered as the equivalent of the Nobel Prize for the life science industry, thanks to the intellectual rigor of its committees. It is my privilege to introduce the Prix Galien USA committees, chaired by 2 true leaders and humanists. Have a wonderful Oscars night in the museum. Thank you.
Prix Galien USA 2025 Awards Committee in the categories: Best Pharmaceutical Product, Best Biotechnology Product, and Best Product for Orphan and Rare Diseases. Committee Chair Michael Rosenblatt, Co-Chair Galien Forum, Advisory Partner Ascenta Capital, Senior Advisor Bain Capital Life Sciences and Flagship Pioneering, Member Harvard Board of Overseers. Linda B. Buck, Nobel Laureate, Fred Hutchinson Cancer Research Center Member, Professor of Physiology and Biophysics, University of Washington. Susan Desmond Hellman, former Chief Executive Officer, Bill and Melinda Gates Foundation. Laurie Glimcher, President and Chief Executive Officer, Dana-Farber Cancer Institute, Professor of Medicine, Harvard Medical School. Mary Claire King, American Cancer Society Professor of Genome Sciences and Medical Genetics, University of Washington. Robert S. Langer, David H. Koch Institute Professor, Massachusetts Institute of Technology. Sir Cato T. Lawrenson, Chief Executive Officer, the Cato T. Lawrenson Institute at UConn, the University Professor and Van Dusen Distinguished Endowed Professor, University of Connecticut. Stephen J. Lester, Medical Director, Discovery Oasis, Founder and Chief Medical Officer, Mayo Clinic and ASU Alliance for Healthcare Accelerator. Stanley B. Prusner, Nobel Laureate, Professor of Neurology, Director, Institute for Neurodegenerative Diseases, University of California, San Francisco. Philip A. Sharp, Nobel Laureate, Professor of Biology and member of the Koch Institute, Chair of the Advisory Board of the MIT Jameel Clinic. Mark Tessier-Levine, Co-founder, Chairman and Chief Executive Officer, Zyra Therapeutics, Professor and President Emeritus, Stanford University.
Prix Galien USA 2025 Awards Committee in the categories Best Medical Technology, Best Digital Health Solution, Best Incubator Accelerator Equity, and Best Startup. Committee Chair, Kenneth C. Frazier, Retired Chairman and Chief Executive Officer, Merck & Co. Chairman, Health Assurance Initiatives, General Catalyst. Rock Dolliver, Honorary Chief Executive Officer, UCB. Michael Dalston, Chair, Prix Galien Bridges Committee, Board Member, Novo Nordisk and Agilent Technologies, Chairman, Board Director and Advisor to biotechs, investment and public companies. Alex Gorski, former Chief Executive Officer and Executive Chairman, Johnson & Johnson. Penny Heaton, Global Head, Office of the Chief Medical Officer, Johnson & Johnson. Sherry McCoy, Board of Directors, AstraZeneca, former Chief Executive Officer, Avon. Joel S. Marcus, Executive Chairman and Founder, Alexandria Real Estate Equities and Alexandria Venture Investments, Co-Founder, Alexandria Summit. Elias Zahuni, former Head of Global Research and Development, Sanofi.
Please welcome back to the stage, Mike Rosenblatt.
Well, before announcing the laureate for Best Pharmaceutical Product, I want to briefly reflect on today's exceptional programs. At the Galien Forum, co-chaired with Ken Frazier and Mark Tessier-Levine, we saw how science, leadership, and humanity are shaping the future of medicine. Our sector's strengths, innovation, patient commitment, and collaboration were evident throughout. Though there isn't time for individual thanks, I wish to recognize the visionaries who made this edition memorable. There was a fireside chat with the FDA Commissioner, Dr. Marty Makary, and that reminded us of the trust that underpins all progress. Our CEO session, featuring Rob Davies, Angela Huang, Julie Kim, and Jean-Frederic Paulson, highlighted how working together drives patient-focused advances. The inaugural Galien Patient Summit, coordinated by Dr. Eduard Cohn, centered patient voices as the true inspiration behind every breakthrough. Today has been filled with ideas and purpose, a celebration of science serving humanity. And now it's my honor to announce the Prix Galien USA laureate for Best Pharmaceutical Product. Pharmaceutical science continues to address health challenges through innovation from gene therapies to new drug delivery systems. This year's nominees exemplify outstanding scientific achievement. Let's recognize the 2025 nominees.
In the Best Pharmaceutical Product category, the nominees are AbbVie for Elahere, Ardelyx for Xphozah, Biogen and Sage Therapeutics for Zurzuvae, Bristol-Myers Squibb for Cobenfy. Eisai and Biogen for Leqembi. Eli Lilly and Company for Kisunla. Genentech, a member of the Roche Group, for Phesgo. Genentech, a member of the Roche Group, for Vabysmo. Gilead Sciences for Yeztugo. Idorsia Pharmaceuticals for Trivio. Incyte for Opzelura. Innoviva Specialty Therapeutics for Zevtera. Innoviva Specialty Therapeutics for Xacduro. Merck & Co. for Winrevair. Novartis for Pluvicto. Pfizer for Zavspret. Fathom Pharmaceuticals for Voquezna. Sanofi for Tzield.
After careful deliberation, our jury selected a winner whose work stands out for impact and scientific merit. I'm pleased to announce the laureate for the Prix Galien USA 2025 in the category of Best Pharmaceutical Product is, having trouble getting it out here, let's see now. It's Gilead Sciences for Yeztugo.
Thank you, truly. I'm Jared Baton. I lead our virology therapeutic area at Gilead Sciences. And on behalf of everyone at Gilead, thank you to the Galien Foundation and to the awards committee for this tremendous honor for Yeztugo, which is a twice-yearly injectable medication for HIV prevention. This moment reflects thousands of people who work as a team, partnership with scientists and clinicians from around the world, and the hope of clinical trial participants and communities who place their trust in us. Over the past 30 years, innovative medicines have transformed HIV from a fatal disease into one that can be both treated and prevented. And that is many of you in this room, and that is what we do every day at Gilead. We have been and we continue to be at the forefront of that innovation. Millions of people around the world are living full lives today with HIV, but more than 1 million new cases occur each year. HIV is not over, and at Gilead, we would actually like to see a world someday where we don't have to work on HIV at all. Yeztugo and its active pharmaceutical agent, lenacapavir, is a result of nearly 20 years of discovery and determination by Gilead scientists. It is a first-of-its-kind viral capsid inhibitor discovered after 12 years of dedicated medicinal chemistry and preclinical science, and with physical and formulation properties that allow 6-monthly dosing. Its clinical trials were the most inclusive and representative global HIV prevention program ever conducted. And in that program, more than 99.9% of people who received twice-daily lenacapavir remained HIV-free. We in this room are in the business of impact here, and we know that transformative science has its greatest impact when medicines reach people. At Gilead, our breakthrough spirit extends into our access planning for lenacapavir, which began years ahead of our clinical trial readouts. And this year, we have had regulatory interactions on 6 continents, and we expect that lenacapavir will be accessible in a lower-income country in Africa by the end of this year, the same year it was first available in the United States. And we're not finished yet. Looking ahead, the unique properties of lenacapavir are the foundation for a new era of long-acting, person-centric HIV treatment and prevention options that we are working on every single day, because our ultimate vision is to end the HIV epidemic for everyone, everywhere. On behalf of the entire Gilead team, we are honored and we are deeply grateful for this prestigious recognition of lenacapavir. Thank you so much. Thank you.
Ladies and gentlemen, to announce the laureate in the biotechnology category, please welcome Professor Mark Tessier-Levine.
Well, it's my great honor and my great pleasure to be able to confer the award for Best Biotechnology Product. This year, as in past years, we've had an extraordinary number of nominees who've done breathtaking work that's advanced medicine and are helping patients worldwide in so many different diseases and conditions. Before we roll out the award, I think we will be looking at the nominees in this category. I'd like to have us take a minute to celebrate all of the nominees.
In the Best Biotechnology Product category, the nominees are Amgen for Imdeltra, Arcutis Biotherapeutics for Xarive, AstraZeneca and Sanofi for Beyfortus, Bavarian Nordic for Vimkunya, Catalyst Pharmaceuticals for Agamree, Gilead Sciences for Sunlenca, Johnson & Johnson for Talvey, Johnson & Johnson for Tecvayli, Johnson & Johnson and Legend Biotech for Carvykti, Merck & Co. for Capvaxive, MGI Tech for DNB-Seq T20, Novartis for Scemblix, Pfizer and Astellas Pharma for Padcev, Pfizer for Abrysvo, Regeneron and Sanofi for Dupixent.
So it's my honor to announce that in the category of Best Biotechnology Product, the 2025 Prix Galien USA Award goes to Regeneron and Sanofi for Dupixent.
Ladies and gentlemen, please welcome to the stage the ambassador of Regeneron and Sanofi.
Are we allowed to bring up some of our colleagues from Regeneron and Sanofi to join me on stage? Come on up, guys. Well, they're coming up. I have to say, first of all, thank you so much for this incredible recognition. But I think this is much more than just a recognition for Dupixent and this great collaboration between Regeneron and Sanofi. I think all of you out there in this industry who work so tirelessly to fight back against the bully of disease should view it as a tribute to everything that you do, because I think Dupixent as a story was this incredible example for our industry of what we all do and what it really takes over so many years to really deliver a medicine that does fight back against disease. This is a story that's more than 40 years in the making. It starts probably with Bill Paul, the discoverer of the target for Dupixent in academia. It involves countless scientists in the labs working for years to prove and develop the drug. It involves countless people working clinically within the companies, but also collaborating with the many pioneering clinicians in the real world, in the field, trying to deliver it to the patients, to all the patients who contribute to and risk for the opportunity to participate in the clinical trials. It's an incredible ecosystem that we're all a part of, and this is a great example of I think what this industry can really do and can deliver. Dupixent is an incredible contribution. For many of us on this stage, we actually have our own children are taking this medicine. This is, you heard from Michael J. Fox, we fight back against the bully disease, and sometimes when you see it actually affect your own child, you appreciate how we have that power, and we have to all work together to do it. And like I said, it doesn't just take one company. This was an incredible, incredible collaboration between so many people and two great companies, Regeneron and Sanofi. What I can tell you, I don't know if there's a conflict of interest here, but many of the people in this room, including who are on the Prix Galien committee in various stages, contributor actually saved this story and this drug, from Elias Zerhouni and John Reed at Sanofi when they were our partners there, to Mark Tessier-Levine. And this is maybe how I'll end it, with just an example of how you got to be very careful trying to make decisions based on commercial projections and the money and things like that. Long before Dupixent was actually approved and launched, and it was just a possibility, and we had another potential big drug, some people were trying to position it to say, well, this drug will be bigger than this drug, so why don't we trade this drug for that drug? And there were a lot of people at the company, at our company, who were willing to trade Dupixent for the other drug. And Mark Tessier-Levine said, wait a second, I wouldn't be so quick. I mean, this drug might actually treat some of the biggest allergic conditions on the planet. I wouldn't be so quick to trade it for anything. And so many on the stage, so many at two companies, so many throughout the ecosystem, whether it be in academia or in the clinical fields, and so many of you helped to make something happen that took a long time, but we think it's all worth it. So we very much appreciate it, and thank you.
Ladies and gentlemen, please welcome Dr. Stephen Lester to announce the best product for orphan and rare diseases.
Well, good evening, everyone. You know, there are moments in medicine that remind us why we do what we do. Moments when science becomes something greater. When, as we've heard tonight many times, when it becomes hope. And in this category of orphan and rare disease, we truly honor a profound frontier of human compassion and scientific courage. For in this category, it's not about the many, but the few, the children, the families, the patients who live each day with conditions so uncommon that for years they were unseen. Yet from that rarity truly emerges something extraordinary, a movement not defined by statistics but by humanity. Scientists who refuse to stop searching, clinicians who refuse to stop believing, and families who refuse to stop hoping. What we celebrate tonight, I believe, is more than just medicine. It's a triumph of perseverance over probability and compassion over circumstance. For in this category, every discovery is a promise that no disease is too rare and no patient too few to matter. And in honor of Mr. Michael J. Fox, who I wish was here today, and maybe he'll remember this if he listens, I leave you with a quote. What's the meaning of life? That's simple. Try to be happy, try not to hurt other people, and hope to fall in love. And with that, it's my honor to introduce the nominees in the category of Best Rare and Orphan Disease.
In the Best Product for Rare and Orphan Diseases category, the nominees are Biogen for Skyclarys, Biogen and Ionis Pharmaceuticals for Qalsody, Ionis Pharmaceuticals for Tryngolza, Jazz Pharmaceuticals for Ziihera, Marinus Pharmaceuticals for Ztalmy, Merus for Bizengri, Novo Nordisk for Alhemo, PTC Therapeutics for Kabilidy, Servier Pharmaceuticals for Veranigo, Springworks Therapeutics for Ogsiveo, Syndax Pharmaceuticals for Revuforj, X4 Pharmaceuticals for Zolremdi, Zevra Therapeutics for Miplyffa,
Well, on behalf of the Galien Foundation and my esteemed colleagues on the awards committee, it's my true honor and privilege to introduce to you the laureate in the category Best Product for Rare and Orphan Disease 2025. This goes to Servier Pharmaceuticals for Veranigo.
Now, please welcome to the stage the ambassador of Servier Pharmaceuticals.
calm down first, because this is a huge moment. A group of boys were playing soccer in the streets of Cairo. One kick sends the ball flying through the door of St. George Church. The boys are looking to the one kid who's not playing, and they say, "Go, get it." So I run through the door of the church, I grab the ball, and then I hear the voice of Father Stephanos. "Why the frown, kid?" And I said, "Well, I never get picked up, but I'm always the guy who has to go pick up the ball." So he said, he put his hand on my head and he said, "Through love, we serve one another." And these words stayed with me. I came to this very city, to this beautiful country 14 years ago as a young physician, aiming to have an impact, and these words resonated in me. And if I'm standing with you today, I'm Islam Hassan, I'm the Global Head of Development for Neuro-Oncology at Servier, and if I'm standing with you here, it's because this simple call for service has resonated and became the compass of my life, but more importantly, for this particular program that you've recognized today. Voranigo is a story of service. I stand here on the shoulders of more than 330 patients with brain tumors in the prime of their lives, who've decided with their families that they want to enroll in a global, randomized, double-blinded, placebo-controlled study in the middle of a global pandemic. They put their trust in us, they gave us their times, and they turned hope into evidence. I also stand here to represent colleagues, my colleagues, whose every step they created was their service. To Susan Pandya, the visionary physician-scientist who set the vision and led with influence. To my colleagues from Servier who've joined me today to celebrate this very prestigious moment. To Lori, my dear friend and mentor. To Stephen, Stefan, to Hua, to Adriana, Lisa, June. It's through your work and dedication to patients that you've elevated the science and this moment was achieved. To my colleagues in Servier as well, who's not with us today, this recognition is yours. To our Servier leadership, to Olivier, to Claude, to Philippe, to Arnaud, to David, thank you. Thank you for trusting in us when the outcomes were uncertain. You've also served by giving us the room to deliver the right things, even if it's the hardest way. You insisted on the highest level of evidence, and you backed a program that goal was not to be first only, but to be right for patients. And honestly, to the entire neuro-oncology community, to the patients, the families, the investigators, the nurses, the coordinators, imaging experts, biostatisticians, regulators, patient advocates, you name it. This is an area where for decades we've suffered from having more questions than answers. And today we came together. We came together to show you that dedicated science, humble listening, and the refusal to accept the limits of the past is the reason why we achieved what we've achieved. And to our fellow nominees, thank you. Thank you for the same spirit, having the same spirit of service and purpose. To the Galien Foundation, thank you. Thank you for recognizing what careful science, courage, and community can achieve. To the patients who entrusted us with their stories, to the families who carried the weight, and to my colleagues who turned uncertainty into evidence, we will keep serving with love until extraordinary becomes the expected. Thank you.
Please welcome to the stage Dr. Whitney Snyder, Vice President, Alexandria Venture Investments at Alexandria Real Estate Equities, Inc.
Good evening. It's a privilege to join you tonight at the Galien Forum in this extraordinary gathering of leaders, visionaries, and scientific change makers who are shaping the future to greatly enhance human health. On behalf of our entire Alexandria team, we would like to extend our sincere congratulations to all the nominees, laureates, and awardees. As the Platinum founding partner of the Galien Foundation, Alexandria is proud to host the Galien Forum each year at the Alexandria Center for Life Science, New York City's first and only commercial life science campus. This mega campus is a cornerstone of our company's broader mission to advance human health through innovation, collaboration, and venture investments. For over 30 years, we've been working to ensure that the U.S. life science industry maintains its science-driven leadership position as one of the world's most impactful, essential, and innovative industries. For those unfamiliar, Alexandria is the leading and longest tenured owner, operator, and developer of collaborative mega campus ecosystems in the nation's top life science innovation centers, including Greater Boston, the San Francisco Bay Area, San Diego, Seattle, Research Triangle, Maryland, and here in New York City. Alexandria's commitment to the life science industry is reflected in our remarkable track record of partnering with trailblazing life science companies to enable their development of life-changing treatments and therapies. We are proud to be the trusted partner to over 700 tenant companies, each working toward making meaningful contributions to the significant betterment of human health. We gather tonight to celebrate, and this is also a moment of profound consequence. The American life science ecosystem has long been a beacon of our global leadership and a crown jewel of our economy, from academia to biopharma to pharma. Today, however, it faces urgent and complex threats. From regulatory uncertainty to geopolitical competition, the stakes have never been higher, and yet the promise of science for patients has never been greater. With over 90% of diseases still untreated by medicine, continuing to advance bold science and technology remains critical. Through our over 3 decades at the vanguard of this mission-critical industry, Alexandria's work is rooted in a core belief that advancing transformative technologies, therapies, and cures is not only a public health imperative, it is a matter of national security, and it requires us to act with clarity, urgency, and unity. Central to this effort to advance life-changing therapies are the foundational institutions that have long underpinned America's biomedical leadership. The NIH and the FDA are not only pillars of our innovation economy, they are stewards of the scientific pipeline that drives discovery through delivery. And today, both face existential threats. At the NIH, proposed funding cuts jeopardize an entire generation of physician scientists, early career researchers whose creativity and energy are essential to the future of medicine. And at the FDA, the erosion of institutional expertise threatens to weaken the agency's ability to evaluate and approve safe and effective therapies and diagnostics for patients. We also must confront the strategic challenge posed by China's rapidly advancing life science sector. Fueled by substantial investment and accelerated timelines, China's rise threatens to erode U.S. leadership in drug development and biomanufacturing. And these are not abstract concerns, they are immediate and measurable risks to the health of our innovation ecosystem. Preserving America's leadership in life science innovation is essential to economic growth and public health. It requires academic research, an entrepreneurial engine, infrastructure for clinical development and commercialization, adaptive regulation, and a fair and appropriate reimbursement system to fuel future innovation. And currently, this synergy is being challenged. Decisive and expedient action is needed to safeguard our continued leadership and ensure our global competitiveness. We urge each of you this evening to please take immediate action by writing your members of Congress to elevate their awareness of this unprecedented inflection point for our industry. Our Alexandria team is helping to lead in this effort, and we are in discussion with and ready to provide a list of members of the U.S. Senate Committee on Health, Education, Labor, and Pensions, and the U.S. House Committee of Energy and Commerce. And together we can make immediate change. So tonight, as we celebrate your extraordinary achievements, let us all commit to the work we have to do ahead. Let us protect the institutions that are sustaining innovation, and let us ensure that the U.S. continues to lead the world in advancing science, improving health, and delivering hope. So thank you for your relentless dedication, and thank you for being part of this vital mission. Good evening.